Opioids are a major problem in today's society, whether in the field of medicine or in dentistry. Patients presenting for treatment who are claiming to be in pain is one way those who are abusing opioids obtain prescriptions for medications. Being alerted to the methods used by those who are only looking to get pain medications and knowing the best way to deal with them has become a major concern of physicians and dentists or anyone who has the ability to write a prescription. Today, more people die from prescription opioid overdose than from heroin, cocaine, and all other drugs combined, an alarming trend that led the U.S. Centers for Disease Control to declare it an epidemic in November 2011. There are variations of opioids, such as natural and semi-synthetic, as well as synthetic opioids other than methadone. The natural and semi-synthetic opioid category is a category of prescription opioids that includes natural opioid analgesics, for example, morphine and codeine, and semi-synthetic opioid analgesics, for example, drugs such as oxycodone, hydrocodone, hydromorphone, and oxymorphone. The synthetic opioids, other than methadone category, is the category of opioids including drugs such as tramadol and fentanyl. Synthetic opioids are commonly available by prescription. Fentanyl is legally made as a pharmaceutical drug to treat pain or illegally made as a non-prescription drug and is increasingly used to intensify the effects or high of other drugs such as heroin. Over 4 in 10 Americans know someone who has been or who is currently addicted to prescription painkillers. No longer is it a junkie in the alley who's addicted. It can be a family member or friend who received opioids after an injury and got hooked before he or she could realize it. Opioids are no longer a drug of the streets. The number of deaths involving opioid pain relievers, excluding non-methadone synthetics, from 2002 through 2016 shows a steady increase for females and a slight dip from 2011 to 2016 for men, at which time it began to increase. In 2016, there were 19,354 deaths total. The U.S. opioid epidemic is continuing, and drug overdose deaths nearly tripled during 1999 to 2014. Among 47,055 drug overdose deaths that occurred in 2014 in the United States, 28,647, or 60.9%, involved an opioid. How does one tell a patient he or she is not in pain? It's a slippery slope on which a delicate touch is needed to handle the situation in the most expeditious way possible. Some patients have been known to steal prescription pads and forge the signature of the prescriber in an attempt to get as many pain pills as possible. The author worked for a dentist who had a trusted patient do just this. The theft was only discovered when a pharmacist called the dentist to see why he was writing so many prescriptions for the patient. Needless to say, this became a matter for law enforcement. Many dental professionals are familiar with patients who present claiming to have severe dental pain. These patients typically have dental pathology that could very well be a source of the pain. Also, some cases the patient may legitimately have dental pain to some degree. Patients truly seeking relief from pain will agree to procedures to relieve the discomfort and want that relief as soon as possible. However, There are those other patients who are seeking something else, and they want only a prescription until their schedule will allow them to return for treatment. So they say. They are exhibiting what is called drug-seeking behavior. Management of drug-seeking patients is a challenge for anyone encountering them. They can be very persuasive, and because serious dental disease is unfortunately still so prevalent, it often serves as a useful ploy to get these patients the narcotics they desire. Many dental professionals have had instances of after-hours or weekend telephone calls from people claiming to be current or past patients who now have a sudden onset toothache and are requesting a prescription for a narcotic pain medication. They always agree to being seen in the office the next day or the following Monday if they can just get some medication to hold them over until then. Often, the patient will not call or show up after having received a written prescription or one that has been called in to the pharmacy. It is well established that non-traumatic dental conditions, such as dental caries and periodontal diseases, are best managed in dental offices where definitive care and continuity of care can be provided. However, visits to emergency departments for these patients have increased over time, and most patients presenting with toothache pain and receiving prescriptions for pain medications there. Although short-term analgesics are critical for managing acute pain, long-term use of analgesics could mask symptoms of underlying injury or disease, create a potential for opioid tolerance and substance abuse, and exacerbate drug-seeking behavior among addicts of analgesics and opioids. Drug-seeking behavior manifests in many forms that may or may not involve oral pain. Their motive is to receive prescriptions for potent narcotic analgesics. Their typical story involves the need for immediate pain relief to give them time to receive indicated therapy. But they will typically not want the therapy at the moment or present when the usual sites of providing the needed ambulatory health care are not open, such as evenings, weekends, and holidays. The individuals will not usually accept anything less than an opioid analgesic and are unwilling to agree to less potent narcotic drugs such as codeine. In the United States, the amounts of prescription opioids have increased significantly in the past 2 decades, from 75.5 million in 1991 to 209.5 million in 2010. U.S. health professionals dispensed enough opioid drugs for every American to take an equivalent of 5 milligrams of hydrocodone 6 times daily for 1 month in 2010. Unintended deaths by prescription opioid overdose have quadrupled in the same time period and become the leading cause of overdose ahead of heroin and cocaine. Prescription opioid drugs were involved in 3/4 of the drug overdose deaths in the United States, amounting to 12 deaths annually per 100,000 population. Drug addiction has been described as a disorder that progresses from impulsivity to compulsivity, characterized by maladaptive behavior to obtain and consume more drugs at the expense of health and social interactions. Chronic exposure to opioids occurs frequently in both therapeutic pain and substance misuse populations. Some of the most recognizable opioid deaths include Michael Jackson by benzodiazepine, Prince by fentanyl, Judy Garland by barbiturates, Elvis Presley by prescription drugs, Heath Ledger by prescription drugs, Marilyn Monroe by barbiturates, and Anna Nicole Smith by prescription drugs, just to name a few. Even though our culture has always struggled with various addictions, the number of casualties to the opioid addiction is staggering. It is estimated that 52,000 Americans died in 2015 due to overdose. To put that in perspective, the United States military lost approximately 36,000 soldiers in the 3-year Korean War and approximately 58,000 soldiers in the nearly 20-year Vietnam War. Why the seemingly disproportionate number of deaths due to the recent opioid epidemic? The calamity is that a broad regulatory and cultural shift released a massive quantity of addictive drugs into the public at large. Once widely available, the supply found people susceptible to addiction. So a person who would never have become a heroin addict in the old days of the opioid taboo now become the equivalent of one in a more antiseptic way. The association of religious involvement with substance use behaviors and its implications on substance abuse treatment has received increasing attention. Several reviews of the literature found that higher religious commitment is associated with greater psychological adjustment and lower levels of drug use, alcohol use, and suicidal behaviors. Several mechanisms have been suggested by which religion may be beneficial for psychological and physical health. 1. Many religions make prescriptions regarding health-promoting practices, for example, by prohibiting substance use or promoting norms that discourage substance use. 2. Religious involvement promotes social affiliations with people who share values that are incompatible with substance use. 3. Religious involvement may increase individual psychosocial resources, for example, self-esteem, self-efficacy, and mastery, which promote healthy behaviors. And 4. Religion supports the development of a sense of coherence. In other words, the belief that the world is meaningful, predictable, and manageable, which enables individuals to experience stress as less threatening and cope with stress more effectively. There is not to say that Christians never have problems with addictions, but with support from the faith community, one can recover and rebuild one's life. The association of religious involvement with substance use behaviors and its implications on substance abuse treatment has received increasing attention. Several reviews of the literature found that higher religious commitment is associated with greater psychological adjustment and lower levels of drug use, alcohol use, and suicidal behaviors. Several mechanisms have been suggested by which religion may be beneficial for psychological and physical health. 1. Many religions make prescriptions regarding health-promoting practices, for example, by prohibiting substance use or promoting norms that discourage substance use. 2. Religious involvement promotes social affiliations with people who share values that are incompatible with substance use. 3. Religious involvement may increase individual psychosocial resources, for example, self-esteem, self-efficacy, and mastery, which promote healthy behaviors. And 4. Religion supports the development of a sense of coherence. In other words, the belief that the world is meaningful, predictable, and manageable, which enables individuals to experience stress as less threatening and cope with stress more effectively. That is not to say that Christians never have problems with addictions, but with support from the faith community, one can recover and rebuild one's life. The stimulus response cells approach is based on Pavlov's hierarchy of needs, which demonstrated that dogs responded to the stimulus of a bell and being fed. Once they were used to the stimulus, the bell, the response could be induced without the actual food present. The advantages of the stimulus response approach are that the salesperson usually follows a canned prescription or set script. The salesperson inserts questions within the presentation to encourage a particular response from the client. The disadvantages are that it does not require or encourage significant involvement from the prospect, nor is it oriented toward the prospect's concerns for specific issues. It also assumes each prospect will react the same way to a particular stimulus and is best limited to low-priced products such as selling magazines door to door. This presentation would have been shorter and more robotic had it used the stimulus response sales method. The selling formula approach assumes that a customer must go through a series of steps prior to making a purchase. The series of steps are attention, interest, desire, and action, or AIDA. This method allows the customer to play a more active role in the purchasing process, yet requires a highly skilled salesperson to be successful. If this presentation had been done using this method, it would have required more participation by the listening audience. The needs satisfaction method, which was used in this presentation, is possibly the most marketing-oriented in that it focuses on customer needs. Needs satisfaction method has three stages: needs development, needs awareness, and needs fulfillment. In the needs development stage, the salesperson identifies the problem to be solved. In the needs awareness stage, the salesperson must ensure that the customer recognizes the same needs as the salesperson, while in the last stage, the needs fulfillment, the salesperson demonstrates how his company, product, or solution can meet the customer's needs. This method is most flexible of the three methods discussed.